With cold and flu season upon us once again, it's important to make sure we're as protected as possible from respiratory viruses. And there's a new campaign from the American Pharmacists Association to remind everyone of the importance of not only seasonal immunizations, but also of other adult vaccines. And joining us with more is clinical pharmacist and trainer with the American Pharmacists Association, Dr. Deanna Tran. Good morning to you.
Good morning. Thank you for having me.
It's an absolute pleasure, especially this time of year with this important subject. So what are the latest updates and recommendations for the flu, COVID-19, pneumonia, RSV, all these different vaccines this time of year?
Yeah, you hit it on the nail. So this is that time of year where it gets a little bit chillier. And so there's lots of respiratory bugs in the air. So we want to get those yearly seasonal vaccines. So this includes the flu vaccine, the 2024-2025 flu vaccine, as well as the COVID-19 vaccine. And then for those who are 60 years old and older, who have certain medical conditions, I would also recommend the RSV or respiratory syncytial virus vaccine. So all of these vaccines, especially those yearly ones, the way I think of it is kind of like you get updates on your smartphone, right? I don't really think twice about, hitting the button, getting those security updates to stay up to date. And that's the same thing here. You want to stay up to date on all of these vaccines so that way you are protected against some of these viruses.
In the modern age, life can be pretty confusing and we all have different things we need to remember. And like you mentioned, your phone can remind you of many different things, but how does someone know exactly what kind of vaccines they need?
I would recommend talking with your pharmacist. Pharmacists are trusted resources. They are experts in medications. So I would talk with them to find out which vaccines are best for you and your medical conditions. And so I would talk with them. They are really accessible. Pharmacists are within the United States, 90% of individuals are within 5 miles of a pharmacy. So it's really easy access to get to that pharmacist, ask your questions, your concerns, and get your vaccine so that you can stay up to date.
Talking about those pharmacists being an exceptional resource for the viewers at home, beyond the respiratory viruses, what other vaccines do they provide?
Pharmacists can actually provide all CDC recommended vaccines. So some additional adult vaccines that you may want to consider include the hepatitis A, hepatitis B vaccines, if you've not received it already. Also shingles, which is herpes zoster. So this causes kind of like a really painful rash. So I would also recommend that for those who are 50 years old and older who have not received it already, and those 19 years old and older who are immunocompromised.
We hear the term high risk a lot, especially in this day and age. So what populations are considered in that way? And should we make adult immunization a priority?
Absolutely. I think that vaccines are really important. It helps to prevent and the illnesses. It helps to reduce the severity of symptoms if you are exposed to and get ill. It helps to keep you out of the hospital. So in terms of these particular illnesses or conditions, I would think of things like heart and lung conditions, including asthma and COPD, as well as those who are immunocompromised. So think of those who may have cancer or are taking medications that put them at a higher risk for just getting sick in general. So all of those are considered high risk, and they should really prioritize making sure they stay up to date on those vaccines.
We're getting towards the time of year where family and friends get together for things like Halloween, Thanksgiving, Christmas, New Year. This is an especially important time of year for people to consider those immunizations, correct?
Yes, absolutely. Because you are in communities where you're more likely to get exposed to all of these illnesses, that's why it's really important to stay up to date. I think of it also kind of like you're wearing your seatbelt. You wear your seatbelt in order to protect you in case you get into an accident. So that's the same thing here. I'm going to always wear my seatbelt. I'm also always going to get my vaccines. So in case I do get exposed, and especially now we're about to hit the holidays, Halloween and so forth, you want to stay up to date and protected in case you get sick.
And just like the seatbelt with immunizations, it's not just about protecting you, it's about protecting other people around you as well, family and loved ones. It's a community effort.
Absolutely. I love that term community effort because it really is. We want to protect everyone around us, protect ourselves, and also protect those who can't get vaccinated because of certain conditions, and our little babies because they are not eligible yet to get their vaccines.
Well, it's great chatting with you this morning. Thank you for all this information. Where can our viewers go for more information?
I would talk to your pharmacist. Right now is October, which is American Pharmacists Month. So it's a great time to get that trusted, connected relationship with your pharmacist. So that way you can get your questions and concerns answered, and as well as get your vaccines.
Well, I got my lollipop from my flu vaccine recently, so I'm a happy man. So thanks again for joining us. And for more information, head to pharmacistmonth.com.